Good evening, and welcome to Future Choices. My name is Fran Snedeker, and I am the producer and moderator of this educational series exploring reproductive health issues. We are filmed at the LMC TV studios in Mamaroneck, New York. For more information about Future Choices and the issues we cover here, I invite you to visit the companion website at www.futurechoices.net. We are focused today on advancing reproductive justice for Latinas in the U.S. In other words, we are looking at what recent changes in healthcare laws mean to our Latina sisters. We were told that at long last, American men and women would finally have access to the affordable insurance coverage and health care they deserve. We know that health care reform, as passed by Congress, was not perfect, but what law is. But even so, it was distressing to me to read a strongly worded article in the Huffington Post decrying the shortfall for Latinas. In this article by Silvia Enriquez, the executive director of the National Latina Institute for Reproductive Health, pronounced, as it stands, healthcare reform does little to nothing to minimize or eliminate costly co-payments for birth control for working women. Scant attention is paid to the financial, regulatory, and social barriers that stop many Latinas from accessing the birth control they seek, even when they have health insurance. Future Choices is very pleased to welcome today Jessica Gonzalez-Rojas, who is the Deputy Director of the National Latina Institute for Reproductive Health, and she's going to elucidate for us some of the concerns expressed in that article and let us know what the Institute is doing about it. Jessica, welcome to Future Choices.
Thank you for having me.
Jumping right in, I wonder what why the costly co-payments for birth control pose a particularly serious problem for working Latina women in the U.S.
Mm-hmm. It's important to note that amongst Latinas that are working in the U.S., many don't work in industries that offer healthcare insurance. And even for those that do, there's oftentimes many barriers. For example, one of our activists in Miami, Jersey Garcia, she had a planned pregnancy. She had a daughter, a beautiful girl, and she then wanted to go on to a birth control method.
This is a working
mother, full-time job, and has health insurance through her mm-hmm. job. Mm-hmm. She wanted to go back on her preferred method, which was the IUD, and she learned that there were additional costly co-payments and fees that were associated with reinserting the IUD. So
we all face mm-hmm. co-payments. Mm-hmm. I mean, so why is this particular?
For her, it was particularly challenging because she just had a daughter, and there was certainly many new costs to raising a child.
Oh, yes.
And the co-payments were something she wasn't prepared to see. It was upwards of $800 for this particular birth control method. So there was it was a little bit shocking for her because that's not something she faced before. And she looked at other options as well, not preferred options, but those were also quite costly, many hundreds of dollars over the course of the year. So it posed tremendous barriers for her deciding what method to use and if she can access the method.
Even though she had health insurance,
even though she had health insurance,
facing stunning.
Mm-hmm.
So this is not good because
mm-hmm.
She wants birth control, and she's an example.
Sure, exactly.
She wants to space out her pregnancies. Mm-hmm. She's taking the responsible approach, sure. But she cannot afford it. So sure. What is the National Latina Institute for Reproductive Health, NLIRH, mm-hmm. Doing for somebody like her?
So there's been a new healthcare law enacted, a sweeping healthcare reform, which poses some promises for women like Jersey, or women who particularly are uninsured and are looking to enter the insurance pool. Many of the Latinas that I mentioned that are working, but currently don't have access to healthcare insurance.
But
So
approximately how many, what percentage of working Latina women lack health insurance?
well, amongst women of reproductive age, which the population that we work with, about 56% of Latinas are uninsured.
Wow.
Some are working and some not, but it shows the sort of challenges that they face in terms of having insurance and then accessing insurance programs. So the healthcare law would set up new insurance exchanges where they'll be able to purchase insurance in affordable insurance in a healthcare exchange. The challenge is that preventative services like contraception are not yet included in this exchanges, whether they'd be low cost or have a low deductible. So affordable contraception is still maybe a barrier, and we're working to challenge that.
So somebody like if the preventive if contraceptive care were by the regulations that are going to be established concerning the new healthcare insurance coverage, if that becomes a part of preventive health care, somebody like Jersey could then switch her work insurance so that to something that is more appropriate to her through the something that. So then she would not have to pay any?
Well, we're hoping. We shall see. Right now, they haven't yet enacted whether or not contraception is going to be included as preventative service. So that's something we will see in a number of years. And Latina Institute is looking to ensure that contraception is included as preventative care, and that would qualify it to either be free or low cost for women across the United States.
But is there any short-term solution for Jersey?
It's going to be very challenging. There are some public programs that are out there, but she may exceed the income qualifications. Those are for very, very low income women. So she may have to determine for herself what she can do and sort of make budgetary choices based on her needs, which is very unfortunate considering that she has a new family to care for and different shifting priorities regarding her budget. So we shall see what happens with Jersey, but we're fighting for inclusion of contraception in the healthcare reform bill.
And you're fighting for that at the national level, or at the state? Do you have to do it state by state, or?
As a national organization, we're focusing on the federal rules. Things may differ state by state as well, but right now we're looking at the national rules, and in a number of years they're going to determine whether contraception may be included. And then right now they've put it onto an independent panel, and the panel is going to review feedback and statistics from communities, and we're submitting comments as a community to advocate for inclusion of contraception as preventative care.
Now, it's going to hopefully be better for Jersey.
Yes.
But what about women who are undocumented, who are not? Talking two things, who are not citizens, because the Healthcare Reform Act only applies to citizens, does it?
Some people who have legal permanent resident status, which means they've come into the country with back documents, have not yet become a citizen. Many of them are applicable are eligible for the healthcare reform options that are being presented. However, folks who are very low income and haven't yet been in the country for 5 years, they would normally be qualified for Medicaid, but under 5 years, they're not able to do so. So they're also in a place of limbo. And then folks who don't have documentation are really left out of the system. They can only access emergency Medicaid, which tends to be childbirth. But they are not eligible to purchase, even with their own money, into the exchanges that are being set up for affordable care. So they're really excluded from the system, and that's something that we fought really hard to get them included, and in the end they weren't. So it was very disappointing that 12 million undocumented people won't be able to get insurance through this new healthcare law.